Hello, this is the final presentation for CSE 6250 Big Data for Healthcare. This project is about using deep learning technology to study chest X-ray disease diagnosis. The project is completed by Team 13. In this presentation, we will first quickly go through the background of the problem and talk about the method we've used. And then I will give an introduction of the dataset we used for model training and view some exploratory data analysis. After that, we will take a look at the architecture of the models we've used. And this will lead to the most interesting part, the results we get in training and prediction. The last piece is some discussion of the result and some issues we've seen during the study. Okay, let's dive in. Chest X-ray is one of the most common non-invasive radiology examinations for many disease diagnoses. But analyzing X-ray image is not an easy task even for those very experienced radiologists, since the appearance of diseases in X-ray images is often vague. But recently, with the growth of computational power and lots of publicly available high-quality image datasets, we are thinking about maybe machine can do this task for us. So that's why we want to explore the deep learning technology for X-ray image classification problem in this study. We used all data from TriExpert dataset in our final models. In that dataset, the image labeling was done by NLP technology, so it has a lot of uncertainty labels. And in the original study, they've done a lot of work to use these uncertainty labels well. And in this study, we decided to go for binary mapping. According to the result in their original paper, for these 5 diseases we are interested in, we use one label for 3 of them and 0 for the rest of 2. And for the rest of these classes, we just use one label. And since this is an image classification problem, of course we go to convolution neural nets. We use ImageNet as the pre-trained model and have tried different backbones, as we mentioned in our project draft. But in our final models, these 3 are used: DenseNet 201, Inception v3, and Exception. We also have tried some data augmentation method in training time, and we have explored image segmentation a little bit using JSRT dataset, and also have tried attention. TriExpert dataset was published by Stanford ML Group, and it's a fairly large dataset collected during a long time, and it was labeled for 14 diseases. All these 14 classes are used in training process, and 5 of them are included in final analysis. Let's take a quick look at the data. Compared to the training set, the original dataset comes with a very tiny validation set, but their distribution on sex and image type are quite similar, so we used this validation set to measure our model's performance. By looking at these random sampled images, although some of them don't have very clear view or shifted a lot, but the overall quality seems good. There are 4 classes have a different age distribution, but most of them are not in our targets. For these 5 classes we are interested at, they have a fairly large portion in disease counts. This is the schema of model architecture. The input image size we are using is 320 by 320. For a base model, we just adopted these backbone models and attached with a global average polling layer and some fully connected layers at the end. We have 2 versions of different combination of fully connected layers. And we also have tried to put in an attention module before fully connected layers to see if the model can learn better. Let's look at some results. Here we randomly sampled images from 2 patients. The first column are the original images, and the rest are 4 showing the data augmentations we've used during the training. There are rotation, shift, flip, and zoom. The data augmentation looks pretty reasonable. Table 1 summarized all these models we've trained in our final run. We've tried 3 different backbones and used the fixed image size and data augmentation parameters. And some of them are using all data from the dataset and the others using 10% of the data. The train and the validation split during the training time is always 0.1. And like I mentioned before, we adopted two versions of fully connected layer connection, and in two of the models we used the attention module. These three highlighted models are with the best performance. We have measured the performance of these models on a test set. Here we listed three of the best models. Among these 5 classes, consolidation, edema, pleural effusion seems always better than the rest 2. We did a simple ensemble on these 3 best models by just calculating the average of the probability. After this, the prediction of all 5 classes have been improved. You can clearly see the trend from this table. In Ensemble 3, our prediction on pleural effusion even beats the original paper. Okay, it's time to see some real prediction results. We randomly choose 2 images from the validation set. The left side are the ground truths, the right side are the predicted results. They correlated very well. When we were doing the plot, we only choose the one with the highest probability, so that's why for the first case, it only shows one prediction. We've also explored attention mechanism by plotting the attention map. Although the results are still very preliminary, but the attention model definitely started to learn something useful. It clearly indicated some regions are more relevant than others. We have met some problems in this study. For example, test time augmentation usually works very well in image problems, but it didn't work in our experiment. And the tiny test set still has some differences to training set, and it even don't have data in one class at all. So in the future, we will have to expand the test set. If time allows, we'd like to do some deeper exploration in attention mechanism and image segmentation. Also, besides a pure image model, probably we can include other features like sex and age, and this will maybe give us some better result. These are the papers and the work we referenced in our study. Thanks for this nice work. That's all for this presentation. Thank you.